Assalamu alaikum. Good morning, everyone. My name is Sara Albalawi. I'm a radiation therapist in King Fahd Medical City. Today I will talk about challenges in embolization devices and how we use innovative idea to overcome it. So first of all, we'll talk in general about the workflow. In radiation therapy, patient will start a journey going through fluent step in the radiation oncology department, starting with the visit of the radiation oncologist clinic, where he will see the oncologist who will explain the treatment, side effect, and expected outcomes. After that, he will be sent to the CT simulation where he will be scanned and embolized. So these scans will go to the treatment planning where the plan will be done. So he can start his radiation therapy sessions and to finish them and come back for us for follow-up clinic after a few months. So for the CT simulation, as we all know, is a major part of the treatment process since it's a critical preparation step before starting the treatment, where we fix and embolize the patient to ensure accuracy and reproducibility for the treatment sessions. So we do have our protocols to follow for each specific site and which embolization devices to use, but still this cannot prevent that we do face some cases that represent challenges and we have to innovate to achieve the optimum patient position. So some examples of the cases can represent challenges for the extremities, mainly for the sarcomas, when it appears in the critical areas of the body, skin tumors in general, and face superficial tumor, and finally scalp or scalp. So for the superficial tumor involving the scalp can represent technical challenging for the radiation treatment planning owing to the skin sparing for our conventional beam due to the build-up region of our beams. To provide adequate dose to the target and minimize the brain dose, boluses are typically used for such cases. So the sobraflab material is the most used material to create a bolus, but for the scalp, this can be complicated, resulting in air gap and irreproducibility. So here where the motivation came to create a custom bolus during the computed tomography using the aquablast bolus. So our case was a 60 years old male diagnosed with squamous cell carcinoma for the scalp, and the status was post-scalp tumor resection T4N0M0. After the visit of the radiation oncologist clinic, patients were planned for CT simulation and external beam radiation therapy. So basically, the patient went through surgery as a primary treatment, and he came for us for adjuvant radiotherapy for 30 gray over 60 fraction. The embolization devices that we used for him were U-frame, headrest, in addition to custom-made cushion, thermoplastic mask, custom bolus, and knee rest. And here is the bolus that we made using aquaplast material, shaped as a helmet in the base and adding layers of wax to achieve the thickness of 1 centimeter. And when the patient lies down, we use the cushion to support and stable the bolus and to ensure reproducibility. And the mask as well was made due to the shape of the bolus and cushion to fit easily every day in the treatment and assure reproducibly as well. And coming to the treatment technique, our planner creates the plan for this patient using VMAT technique, 3 half arcs with the energy of 6 MV. And this photo here clarifies the dose distribution, and we can see the nice coverage of the BTV with 95% of the dose, and with the good skin sparing due to the effect of the bolus. So, talking about the bolus effect, I will explain briefly about the bolus and its effect to the patient. So here we have the percentage depth dose for the 6 MV, whereas our Dmax is within 1.5 centimeter depth. And this is our build-up region before our Dmax. And let's apply this for a body. So we can see our isodose line starting 70 at the surface, 1890 following to find the Dmax located at the depth of 1.5 centimeter. And after applying the bolus, these isodose will be shifted starting from the surface of the bolus to reduce the Dmax to 0.5 centimeter. Will have a good impact in such a cases that we discussed earlier. So we do have the knowledge and tools, and we do have the ability to innovate with these tools and use the maximum benefit of them. Applying this to our treatment process and our practice, seeking for the best way that the patient can be treated with will take a role to achieve the perfect result. So, in conclusion, I would like to say that when we understand each step of radiotherapy and the importance of these steps, working accordingly with the oncologist's prescription and taking into consideration the physics preferences to achieve the optimum plan, this will lead to a quality and effective treatment. So finally, our environment is a connected network environment, whereas the teamwork is highly valuable and effective. So thank you and